The role and benefits of exercise in the management of chronic health conditions. Hippocrates wrote, "In a world, all parts of the body which were made for active use, if moderately used and exercised at the labour to which they are habituated, become healthy, increase in bulk, and bear their age well. But when not used and when left without exercise, they become diseased, their growth is arrested, and they soon become old." I think this is very appropriate for discussing chronic disease. The role and benefits of exercise in management of chronic health conditions. Through this presentation, I will focus on a few key areas in regards to the role and benefits of exercise when referring to chronic disease patients. Firstly, we will look at what is a chronic disease and what are some of the key areas that define a chronic disease. We will also look at the national and international burden that chronic health conditions place on the nation and the world's health system. I will also identify key historical events that led the world to recognise exercise as a key treatment method in chronic health cases. I will then look at both the physiological and psychological benefit of exercise and how it contributes to improving people's health status. I will focus on such points as what type of exercise is best, what age and sex does chronic conditions affect, and does exercise help, and also what's exercise's general role when it comes to treatment. While this presentation is aimed at looking at chronic health conditions as a whole and the role of exercise, there is specific conditions we will discuss to further reinforce the importance of exercise. Exercise, its role and benefits. Physical inactivity has been identified as a major health concern that affects all people worldwide. By decreasing or removing unhealthy behaviours and attitudes, people's health would subsequently improve substantially. This includes an individual's physiological, psychological, and biological states. Studies have indicated that exercise is beneficial for preventing and/or treating numerous medical conditions. What is a chronic health condition? As defined by the Australian Institute of Health and Wellbeing, a chronic disease is a broad definition of any condition that is has a complex causality, has multiple risk factors, has a long latency period, is a prolonged course of illness, and/or provides functional impairment and/or disability. Conditions are generally not spontaneously resolved and are rarely cured completely. Diseases range from life-threatening such as strokes and heart attacks to non-life-threatening but are persistent throughout a person's life. These are such things as arthritis and diabetes. Chronic conditions place a significant burden on the nation and the world's health systems in terms of mortality and morbidity. 12 chronic conditions have been identified as focus areas in the National Public Health Partnerships paper, these being oral disease, chronic obstructive pulmonary disease, osteoporosis, chronic kidney disease, asthma, arthritis, ischemic heart disease, type 2 diabetes, stroke, depression, lung cancer, and colorectal cancer. But how many people have chronic disease? The 2004 and 2005 National Health Survey found that just over 7 million people reportedly suffer from at least one chronic disease, with the reported number of people suffering from a chronic disease increasing with age, as does the number of people suffering from more than one chronic disease condition. Exercise and its role through the ages. Exercise scientists and physicians have been looking at the benefits of exercise and its role and the role it plays in treating individuals that are suffering from illness and disease for many centuries. In the 1880s, scientists focused on exercise as a maintenance tool. In 1904, Mackenzie recognised exercise as a tool for rehabilitating wounded soldiers and individuals that were suffering from disabling injuries. And through the 19th and 20th century, physicians debated the impact of exercise in treating heart disease. Gradually, health specialists have recognised the importance of exercise to assist in treatment of many conditions such as pulmonary rehab to better lung disease. Diabetes and obesity specialists use exercise as a therapy tool in reducing symptoms and reducing weight gain. And geriatricians use exercise to maintain functional independence. The impact of inactivity. Inactivity is looked at Min, Sharoma, Philippe, Pecker and Blair looked at a life table analysis to predict gains in life expectancy of the world's population. Worldwide, it is estimated that physical inactivity causes 6% of the burden of disease from coronary heart disease, 7% of type 2 diabetes, 10% of breast cancer and 10% of colon cancer. Inactivity causes 9% of premature mortality, or more than 5.3 million of the 57 million deaths that occurred worldwide in 2008. If inactivity were not eliminated but decreased instead by 10 to 25%, more than 533,000 to 1.3 million deaths respectively could be averted every year. It is estimated that elimination of physical inactivity would increase the life expectancy of the world's population by 0.68 years. For psychological benefits. Not only does exercise contribute to improving physiological aspects of an individual with chronic disease, but it is also shown to improve an individual's psychological well-being. Chronic disease patients' psychological well-being has been shown to improve when they are involved in exercise programs that allow them to discuss their condition, their coping strategies, and general anxieties with other patients in the same position. Anxiety disorders are prevalent in individuals that are physically inactive. Incorporating exercise with other evidence-based treatments for anxiety has shown to be promising and beneficial to those that engage in such programs and treatment methods. As a result of exercise participation, people's own anxiety is reduced. Social benefits such as comparison with others and group support help to improve individuals' desire to stay involved in exercise, but also improve their psychological status. This flow diagram shows how chronic disease patients indicated they felt whilst involved in exercise programs. It also shows what encouraged them to stay involved and inevitably helped them to feel more positive about their condition. The aging population. As chronic disease prevalence increases with age, it is no surprise that exercise programs designed for the elderly are prevalent and are seen as an effective way to assist the elderly that suffer from chronic disease. Aerobic exercise and strength-based programs are the leading exercise treatment methods for patients that suffer from such diseases as diabetes and osteoporosis. Benefits of exercise in chronic conditions in children. As stated by Philpott, Horton and Luke, physical activity should be encouraged in all children. There are a number of positive outcomes that result from children being involved in daily exercise. These include social benefits. Children that are involved in exercise and sporting activities are generally in a group situation which allows them to build social skills, friendships, as well as improve their fitness levels. There is also a number of biological benefits that result from being involved in exercise. These include such things as reducing loss of proteoglycans, reducing cartilage damage, optimizing bone mineral density, and reducing obesity, which in turn results in lessening joint load. Specifically, we can look at chronic health conditions that are prevalent in children and identify major factors that improve when children are involved in regular exercise. For example, haemophilia. Regular exercise has shown to reduce the number of bleeding episodes a child has. Exercise also increases muscle strength. Specifically looking at weight-bearing exercises, there has been a noted increase in joint stability, which also contributes to a reduction of risk of injury. And when speaking of proprioceptive training, it has shown to decrease joint damage. Asthma. A reduction in exercise has shown to increase bronchial hyper-responsiveness as exercise hours decrease. Aerobic fitness such as swimming has proven to be beneficial in increasing aerobic fitness and improving day-to-day breathing and decreasing asthma morbidity. In reference to cystic fibrosis, children with high aerobic fitness experience slower deterioration in lung function and greater survival rates. Can also be noted Nixon, Ornstein, Kelsey and Doerschuk's study indicated a significant correlation between an individual's aerobic fitness and survival in relation to patients with cystic fibrosis. These findings were irrespective of age and/or sex. For physiological benefits, Derman, Schwellnus, Hope, Jordan and Padici designed and implemented a 12-week U-turn program that was a patient-centered lifestyle intervention program. It was applied in a multidisciplinary medical setting. It found that patients who enter such programs are generally suffering from multiple chronic health conditions and therefore require a patient-centered management program rather than a disease-centered program. Those involved in the program reported a reduction of numerous risk factors and also reported an improvement in functional capacity. The study found that the majority of patients involved in the U-turn program had a reduction in body fat and their waist and hip circumference measured smaller following participation. Functional measures such as resting heart rate, resting systolic and diastolic blood pressure, and maximum heart rate also improved post-program. The distance in which individuals walked during 6-minute walk testing also improved, on average by 102 metres. Metabolic outcome measures in total cholesterol, triglyceride concentrations, and LDL improved from the time in which the participants began to when they completed the program. In today's Centres for Disease Control and Prevention, exercise prescription has been identified as having two main exercise prescription types. These being anything that is more than what the individual is doing at present. Activity level, that is anything above their general activity level. This is generally prescribed to individuals that have a low exercise tolerance and is used as a starting point. The second exercise prescription is getting patients involved in large muscle group activities with a duration of 30 to 40 minutes, 4+ days a week. This is used as an overall goal for the individual to maintain as a lifestyle behaviour. This approach has probably been a step forward, but it must be recognised that it is a sociological compromise that falls far short of a true exercise prescription. It should be remembered that exercise programs that are undertaken with any individual with a chronic disease condition should be supervised by medical staff, and programs should be multidisciplinary in nature. Exercise and its role. When discussing why exercise is beneficial in chronic disease, it is viewed in terms of how it contributes to reducing symptoms and prevalence of the disease, such as reducing incidence of type 2 diabetes, reducing mortality rates in coronary heart disease, lowering blood pressure in hypertensive patients, improving glucose control in diabetes, and improving symptoms of depression. In conclusion, irrespective of age, exercise, whether aerobic or strength-based training programs, have been found to be beneficial to those that suffer from chronic diseases. Gains in aerobic fitness and endurance are evident through many age groups. Chronic health conditions affect all ages and races and genders. Chronic health conditions contribute to the majority of the nation and the world's health burden. Exercise has been shown to improve chronic health conditions and is progressively being used more and more as a treatment method for chronic health conditions. As Goldman Smith states, the better educated and rich people are, the healthier they generally are. Through education and understanding, people that suffer from a chronic disease are not only able to better understand their condition, but they are able to be educated on the benefits of exercise and the long-term positive effects it can have on their overall health and well-being. Thank you.